So, good morning. I am Dr. Star Pala from Negrim, Shillong. So, as part of the Center of Excellence under NPCCHH program, I will talk a little bit about the climate sensitive health problems in the Indian hilly mountainous region and its adaptation plan in the health sector. As we already know that climate change is a dynamic process and it is can lead to serious health problems all over the world, especially for hilly and mountain region. I'll try to make the presentation. The first one on the climate change and hilly mountainous region, vulnerability of the region in terms of climate change, health related problems in the region, health sector, things to do and how the things are to do so that we can overcome or adapt to this climate change. And the last one is multi-sectoral engagement so that we can achieve our goals. So just an introduction, we know that generally the hills and mountainous region of India, it extends from Ladakh, Uttarakhand, Himachal, Sikkim, and all the northeastern states and the parts of Bengal, the Darjeeling Hills. So do we have other hills also in other part of the state in India? But these are the main concern about the hills and mountainous region. So these hills and mountainous region are of special focus by a special program also because they are vulnerable and because maybe low in resource setting. That's why in most of the national program of the government, the funding is generally 90% central government and 10% from the state government. It is also difficult terrain and hard to reach areas, especially road condition, connectivity is poor in the hilly and mountainous regions. So this leads to more vulnerability. As I told you, it is low socioeconomic status. So achieving of universal health coverage is a challenge due to accessibility and affordability. And hilly and mountainous region are more prone for natural disasters like earthquake. Climate change, as I told you, is very clear and convincing that is changing at a very fast rate. And what will be the impact of the climate change? It all depends on what majorly because of the water supply will impact on the water supply and also on the spread of infectious disease, especially vector-borne disease. So hills and mountainous region are most vulnerable to climate change, as I told you, because they have the least resources for adaptation. So climate change poses a number of potential risks to mountain ecosystem, especially agriculture, disaster, infectious disease. And hills and mountainous region will show early indicators of climate change. They are very sensitive. Even to a small change in the climate, it leads to impact on the environmental in the hills and the mountainous regions, ultimately impacting the health of the people, which may lead to injuries, morbidity, and mortality. So also the impact on land use. So as we all know that because of climate change, it will impact on the agricultural activities and other consequences. So migration of people to sustain their income due to seasonal variation of agricultural activities. If the agricultural activities is not economical and they are not able to support their families, so The people from the hills and mountain ranges have to find an alternative occupation to sustain their family income. What are the potential disasters in hilly and mountainous region in the context of climate change? So extreme weather events, thunderstorm, lightning, landslide, avalanche in Jammu and Kashmir, Himachal Pradesh, cloudburst, flash flood, all the hillies, but very common in Uttarakhand. Extreme winter cold waves, forest fire also. So these are the common disaster. And earthquake. Earthquake is very high risk for all this hilly and mountainous region, and also especially the northeastern region of India. So as we see from this map, the vulnerability, we see this red is showing high vulnerability for climate change impact. We see it extend from Pakistan, Nepal, and northeastern states. Especially in the northeastern region, extreme rainfall and floods are common. So we usually have in the northeast also floods, mainly in Assam. We have some flood even in Meghalaya also. So flood is there. So the important thing is we have to map this vulnerability areas. So how to do it? So vulnerability is defined as degree to which individual and system are susceptible or unable to cope with the adverse effect of climate change. Vulnerability to various diseases may lead to weather condition because of temperature, precipitation, ecological changes, even deforestation, soil pattern, environmental interfaces. So how we can do this mapping? So this one assessment has been done, climate vulnerability assessment for the Indian Himalayan region using a common framework IACAP 2019, which has been done. They have based the vulnerability on 4 factors. Number 1 is socioeconomic demographic status and health. Number 2 is sensitivity of agriculture product. Number 3 is forest dependent livelihood, as in the hilly and mountainous people depend on the forest livelihood. Fourth is information, service and infrastructure. So based on these 4 indicators, like I'll expand the socioeconomic demographic status, health indicators. Mainly what they see is to see the vulnerabilities, they see the population density, marginal farmers, livestock to human ratio, per capita income, number of primary health center per 1 lakh households, and percentage of women in overall workforce. So based on these factors, so the hilly and mountainous region are classified as high risk, low risk, medium risk, and low risk. So we see Assam and Mizoram among are the high risk based on the vulnerability index of those 4 major index. And the other state of Jammu and Kashmir, Himachal as medium, and Sikkim, Uttarakhand are in the low risk. So we see Assam is the highest risk of 0.72 index, Mizoram 0.71, then followed by Jammu and Kashmir, Manipur, Meghalaya, West Bengal, Nagaland, Himachal. So the least is Sikkim. So the only question here is that it's not that they are low risk, mean we have not to take any measures. All are at risk, but some states are relatively less vulnerable based on the indicators. That means like Sikkim has more adaptive capacity. Uttarakhand also more adaptive capacity to uh, adapt in case of the impact of climate change. That's the only thing is relatively, but all are at risk. So like Assam is the highest vulnerability index. So what are the factors which lead to this high vulnerability index in Assam? So basically few factors just to mention here: deforestation, low per capita income, lack of alternative income, or low coverage days of employment under MG and REGA, low female literacy rate. So these are the factors which have high impacts for vulnerability in Assam, especially the district of Dhubri, Lakhimpur, Sonitpur, Golpara, and others. So high dependence on agriculture and lack of alternative source of livelihood increase vulnerability of the state of Assam. Also, loss of forest cover and low female literacy rate reduce the adaptive capacity of the state. So this vulnerability, as I have discussed, is that it is based on the low adaptive, how the state will adapt to the impact of climate change. So also we see in Meghalaya also in the medium risk. So West Khasi Hill district is ranked as the most vulnerable district in the states. So based on the limited resource of adaptive on based on the 4 indicators. So what is the pathways for weather to affect the health or climate to affect health? So you have climate change, then lead to environmental condition, climate change lead to social condition, then health system conditions. So the impact of climate change may be direct exposure as heat, cold, or indirect exposure like change in the food quality, disease vector, ecosystem, or disruption in social activities. All this may have uh, direct and indirect impact on the health status of the people. So mapping link between climate change and health. You can see the climate change is also will have adverse impact, but some impact will be beneficial. But the expectation are not for the new health risk, but rather change in the frequency and severity of the existing health risk. So that's whatever existing health problem we are having. So maybe the change in that because of climate change. So what we see here, climate change lead to human exposure, regional changes, heat waves, extreme weather, temperature, precipitation, and these lead to contamination pathways like contamination of water bodies, transmission dynamics of infectious disease, agroecosystem hydrology, socioeconomic demographies. So the impact will be on different areas. Then will be the health impact is can be because of temperature related illness, extreme weather, air pollution, water and foodborne disease, vector borne and rodent borne. Okay, so we see air pollution in general is low in the hilly and the mountainous region, but the impact of air pollution in other part of the country also will affect the hills and mountainous region what we have discussed. So what are the potential health impact of climate variability and change in India? So as I told you that the impact of climate change will be on water supply and majorly on water supply and infectious disease. So there is an increased evidence of incident of vector-borne disease in previously unreported mountainous areas. Also, the incidence of waterborne disease are likely to increase due to contamination of flooding, increased human movement on drying up of water bodies. This may increase, but what we see as of now is there is a drastic decrease in the vector-borne disease, especially malaria in the last 5 years, more than 80% reduction in the number of cases and deaths due to malaria. But in case if we don't take action, it may increase in some area. So climatic change may exacerbate the various type of flood that are already common in mountain areas, such as riverine floods, flash flood, glacial lake, outburst flood. So this we have to take care to prevent the impact. So what we have seen in based on various studies, like in Nepal, there's outbreak of Kala Azar and Japanese encephalitis, which has been linked to climate change in the subtropical and hot regions. So there also has been a growing concern in India also about the changing pattern of this disease as a result of climate change. So what do we see that vector of falciparum malaria is reported to be spreading to higher altitudes in the Himalayas, as reported by Bhattacharya et al. 2006. So with the improving in temperature, increasing in temperature, so the vector also move to higher altitudes. So report possible outward transmission of leishmaniasis also has been reported beyond 600 meters in Garhwal and Himachal Pradesh in India, where it was previously not endemic. So this is maybe one reason is because of the climate change. So also for Aedes aegypti, it has been recorded in the Kumaon Hills of Uttarakhand at elevation higher than previously reported. So that's what this vector are shifting from lower altitude to higher altitude because of climate change. So we have seen in Meghalaya also, just Japanese encephalitis was not reported earlier, but since 2009, 2010, the cases of Japanese encephalitis was increasing up to last 2-3 years. It is controlled, but this also may be because of the climate change, which lead to shifting of the infectious disease, vector-borne disease. So we have to see the health determinants and health outcomes that are currently exist in mountainous region or are related to mountains. So this is a table showing that what are the health determinants on health outcomes. So what we see is it can be in the form of heat waves, glacial lake, flash flood, water scarcity, water quality. This all will impact in different countries. So we have in India also that this impact is present elsewhere in the country. If we have a plus, that means is present elsewhere in the country. If we put only the M, that means in the mountain and hilly region. So waterborne disease, malaria is present elsewhere also. Japanese encephalitis is also elsewhere. Kala Azar also elsewhere. So this water scarcity, water quality is mainly impact in the mountainous and hilly regions. So you can go through this table. Also, we have the waterborne climate sensitive disease, like we have cholera, acute diarrheal disease, enteric fever, viral hepatitis. So these are also related to climate sensitive disease because of the contamination, rise in temperature, bacterial survival and proliferation time also increase, precipitation. So this may be caused because of the contamination of the water or poor sanitation, flood, lack of potable water, fecal-oral transmission. So this may lead to even outbreak of cholera or acute diarrheal disease in the hilly and mountainous region. So vector-borne climate-sensitive disease. So as we all know, malaria is very high potential. Japanese encephalitis, dengue, chikungunya. These are also same that they have because of the environmental changes, temperature, precipitation, humidity. Okay, so this is also, and also maybe because of the other non-climatic factors. This all will aggravate to the potential epidemic of vector-borne disease. But as I had told you, we have now decreased all this vector-borne disease in India and also in the hilly and mountainous region. But this may increase in the future, so we have to take care to prevent when times to come. So as we say that vector-borne data, government data indicate no rising of waterborne disease. Vector-borne disease also reduced, maybe because of the better public health measures. But we have to alert with the climate change. The only thing is we have to take care of these changes. Now, what can be done from the health sector? So important thing to be done from the health sector to overcome this impact of climate change. We should have an integrated surveillance system with stakeholder like IMD, Ministry of Forest and Climate Change, for early detection and preparedness. So we have to get the early warning so that action can be taken. So we have to train the manpower for the management of climate change related disease or condition, especially infectious disease or even animal bites, snake bite has to be trained and also has to provide the facilities for treatment. So universal health coverage is also needed. Now as we have the Ayushman Bharat, so the people are able to get the healthcare facilities and afford to have the minimum healthcare facilities. Also, we have earthquake resilient hospital along with other safety measures because we know that hilly and mountainous region are prone for earthquake. So we should have a earthquake resilient hospital. At least in the case of disaster, our hospital should be safe and we should be able to take care of the eventualities. Entomologists unit to be strengthened for better surveillance of vector-borne disease because as I told you, the vector are changing with change in the climate. So we should have a good monitoring system of the vector. So we should have a well-equipped trauma center, at least one in each strategic location for better management of disaster in case of earthquake, flash flood, or any other disasters. So the health department has to coordinate with other department in the state for prevention of and mitigation of climate change activities. We should adopt carbon-free alternative like solar lights and other activities so to reduce the impact of climate change. Also, we have to do collaboration with different research institute in the hilly and mountainous region. Like we have in the Northeast Regional Medical Research Center, ICMR, Dibrugarh, they are mainly doing activities on vector-borne disease, malaria. So also Malaria Institute, Guwahati, you can take the help how to monitor this vector-borne disease and also for evidence. So there are key adaptation strategy for with specific role and responsibilities. So like we have vulnerability assessment, which has to be done by Indian Meteorological Department, Geological Society, and other regional space application center. We have this in the Northeast. So this assessment vulnerability will help in forecasting extreme weather events, monitoring the temperature, and mapping of the areas. So this is very helpful as of now. Also, we see that they have predict rainfall. So people have taken care before any of these impact has come. So baseline survey has to be done by the health department, and we have to have a robust monitoring and reporting of climate sensitive disease and linking it to data provided by IMD and Geological Survey of India. So we should have a baseline prevalence of the disease to see that whether it's increasing or decreasing. So identification of stakeholders, number 3. So NIGRIMS along with the state health department in the region, and so we have to identification of all stakeholders responsible for execution of action plan with appropriate communication. So, and also we have to do capacity building of stakeholders. So we have to do the training along with the NCDC, New Delhi. So NIGRIM with state health departments, we have to orient all the stakeholders on climate change and its impact. So development of zone specific action plan. So this has to be done by different stakeholders, as all the states have made the action plan on climate change. So we see different state has different activities based on the needs. So all the stakeholder has to come into play, and we have again to orientation of all stakeholder on climate change and its impact. Number 6 is we have to generate awareness generation IEC for delivery of this climate change adaptation plan. So the state and the district health society in collaboration with the Center of Excellence and NCDC, so we'll prepare the IEC material relevant to climate sensitive disease, and also for orientation of grassroots level workers for delivery of IEC. 7 is monitoring and surveillance. Surveillance is the most important part. So state and district health society in collaboration with Center of Excellence, NIGRIMS, Public Health Engineering, State Pollution Control Board, we have to get all the indicators to know the alert when to take action, so that we'll know that something is going to happen. And this monitoring and surveillance is an ongoing process where the state and the district health society with existing IDSP framework will continue the robust monitoring system. So outline of resource required, human resource should be trained, expert, analysts from public health, state disaster response team, agriculture, water, forest department, IMD, entomologists. All this we need to come together. So financial input is most important for vulnerability assessment, training of manpower, implementation of action plan, and monitoring of the action plan. So logistic, as I told you, we have to have a good health infrastructure with logistic for diagnosis and treatment of the common disease due to climate change, and also to have a trauma center for the management of earthquake or road traffic or landslide. And we should have state-of-the-art laboratory for diagnosis of common vector-borne disease and also for zoonotic disease. So action for risk reduction and management, we have to have risk communication. So this has to convey how we convey and transmitting information within parties about impending public health risks. Also situation management. So we have to focus on audience focused communication, choice of messenger, who people trust. So we have to have this communication is the most important in any disaster happening. So we should have a well-planned risk communication and situation management along with the disaster management. So this is a risk management cycle, like we have identification of hazards, then risk assessment, policy development, policy implementation, and again we have to evaluate the policy and make the changes. This is a continuous process of risk management cycle. So this framework we have to make for the risk assessment, like I told you, for vector-borne disease and waterborne disease, we have to find what is the risk, what is the impact, control measures, and the resource required for this climate sensitive disease. This we have to develop. And also for these disasters, For earthquake risk vulnerability, all the region have is very high risk for earthquake in the northeastern states, Jammu and Kashmir, Himachal, Uttarakhand, landslide, cloudburst, flash flood, thunderstorms. So this logistic and require at the healthcare facility already discussed, preparedness of health system and personnel, IEC, communication system, this we already discussed, and to how to establish the integrated system, surveillance system also we already discussed. So this integrated surveillance system is most important, but entomological parameter to monitor the trend of breeding site of different vectors in a different altitudes is also very important, and movement of new habitats also to be taken into consideration as they may expose to new risks. So we have to develop model an early warning system along with the different stakeholders so that we can monitor this climate change. So how to mechanism to ensure data surveillance, alert generation. As we have surveillance, we have human resource and information technology, reporting of cases and deaths. This we already have existing in IDSP. Rumors, outbreak investigation also we have existing in IDSP. Alarm factor, risk factors. So this climate factor need to be added in our surveillance systems. As of now, there is no climate factors. So now we have to add this indicator also along with the disease surveillance. So what do we do? So the algorithm of action, any alert signal or any event to climate change. So then they will inform the nodal center to analyze interpretation of the data following action. You have to consult all the concerned district health official for a verification. Then ensure logistic as per needed. Then rapid response team to follow. This is like any other outbreak of disease or any disaster happening. This is a common algorithm to be done and also to have a feedback. So to summarize it, mountain and hills are sensitive to climate change. So health adaptation plan of the subject area of the central and state level needs priority to address the health related issues of the region due to climate change. So under NPCCHH program, so NIGRIM as Center of Excellence and the state nodal officers, district nodal officer from the region with others expert need to work out the timeline and targets for increasing the adaptation and resiliency development of the health sector in these hilly areas. So state nodal officer, district nodal officer have a great role to play along with the Center of Excellence and NCDC. So this is a first step in this presentation. So I hope in the coming days with more experience in this field, so we'll come with a better presentation and also for good discussion. So I hope wish you all the best in your role for how to do this adaptive for the climate change in the hilly and mountainous regions. So thank you for listening to this brief introduction about the impact of climate change in the hilly and mountainous region in India. So thank you so much.